it's my privilege to introduce you to one of our cardiosurgical centers in Poland. We are here in Bielsko. This is a hospital mainly designed for the treatment of the cardiovascular disease, starting from the diagnosis to the most sophisticated treatment of the cardiovascular disease. We are equipped in excellent innovative equipment for the diagnosis and 2 operating theaters which are equipped in a hybrid room. That means that it's a special room for the minimal invasive procedure which are very fashionable now in cardiac surgery and in cardiology. It's situated in Bielsko. Bielsko is in the south of Poland. It's a very nice city, old city and new city, and it's not far from the mountains. From the Beskid Mountains, which is the biggest recreation area from Silesia and for Poland. In Beskid Mountains, we've got the many recreation possibilities to treat the patient after the operation as well, having the very comfortable rehabilitation centers. So what we can offer here in this center? We can start from the diagnosis. We've got the special diagnosis, non-invasive diagnosis, 3D echo. We've got the catheter laboratory. We can diagnose your narrowing of the coronary vessels. We can diagnose the valves. We can diagnose all the pathology of the heart, having the newest possibility for CT scan and magnetic resonance. And if unfortunately we find that something is wrong with your heart, we can treat it on a very sophisticated base by special stents. We can use nearly every stent is all over the world, using the special stents for widening the coronary arteries, and we can treat the valve as well during the operation, and we can treat the valve with a special method, especially very popular now incompetence of the mitral valve. We can treat without cutting the sternum. We can treat it just through the mini sternotomy, using the robotic equipment, using the endoscopic equipment, and the newest technology of the valve repair. In our centers, we working only the specialists which have the big experience from the academical centers. They move to our centers because of such an excellent possibility to develop the new method of minimal invasive treatment of the cardiovascular disease. So in this center we can do the coronary graft, we can do the valve repair, we can do the valve replacement, aortic replacement, aortic valve and valve replacement, and every kind of cardiovascular procedure we can treat here. Now the people don't want to stay for a long time in the hospitals. Everybody is busy, so we are concentrated on a fast track. So what does it mean? It does mean that we are very accurate in doing the diagnosis, so it shouldn't take us more than 2 days or even 24 hours. And after the diagnosis, we can treat the patient according to the disease. If it is operation, we think that the patient should stay in our hospital up to 7 days if there is no complication, and we are trying to do everything not to have any complication. And with the catheter based, that means the angioplasty, it's very fast, and we can keep the patient 24 hours or sometimes 48 hours after the procedure, coronary angioplasty. And if the patient needs a rehabilitation, we can admit the patient to Ustroń, which is in Beskid Mountains, to the best rehabilitation center in this region.